Hi everybody, I'm here with Stephanie George. Stephanie is an Ida Nation. She's an international board certified lactation consultant and Aboriginal midwife. She is well known for her work as an advocate for Indigenous health, women's health, mental health, and as a breastfeeding educator. Stephanie's been working in this field for over 16 years and has extra training in trauma and grief. Welcome, Stephanie.
Hello, Carole. Nice to see you.
It's wonderful to have you with us. So we've been friends and colleagues for quite a few years, and I was recently reading a post that you had about grief and trauma sort of during this period of COVID-19, and I was thinking of how important it is for us to talk about it. So I'm wondering how it's actually impacting your community and your work as a midwife and IBCLC. And I'm just wondering if you'd like to share a little bit from the grassroots or from the ground in the community, because I really feel it's important that we can share this information so that everybody sort of feels supported. So with your knowledge of trauma and grief, what would you like to share with our community?
In the community, people want quick answers. Mm-hmm. Like there was an independent business on my community that started delivering food immediately, which is great. But no matter what level of government you have, logistically, you can't start up in 48 hours as much as you want to. So my community had a state of emergency. I think we're in day 10 or day 11 of our state of emergency. So they've been planning that whole time. My husband is the IT director, and he's been able to do a project in, again, about 10 days that usually takes 3 weeks to do. Yeah. And he's exhausted, and he's been working like 15, 16-hour days. And I'm very proud of him because he wants to get it done, and he wants to do the best job possible, but people are still complaining that it's not done fast enough. So we really need to see what's actually happening. There's a great quote from John Kabat-Zinn. He says, we need to see things from the child's perspective. And it's not just children we need to listen to right now, although we do, but we need to listen from everybody's perspective. I'm a midwife, and some of our moms now can't have the birth that they want to because we have to limit the amount of people that can come in. We're not even doing births at our birth center anymore. We are only doing home visits, and that's only if nobody in the house has the virus. So people are grieving all their plans, and one of my clients right now, actually two of my clients right now, their babies are in the NICU, and dad can't go in. Mom can't because she's recovering, and dad can't go in and see the baby, and they're feeling lost. Mm-hmm. They're feeling like the baby's not even theirs right now because it belongs to the hospital because it's the hospital's rules. Yeah. And we have to give people space to say, I'm having a bad day or I'm having a bad week. Mm-hmm. Because if we don't let it out when we're experiencing it and we push it down, when it finally comes out, it's going to be in a much worse way and much more, hopefully not, but more anxiety or more anger. Because anger it's a quick, normal emotion, but it can be very dangerous at the same time if it's released in an unhealthy way.
Mm-hmm. And what are you seeing, because clearly birthing has changed significantly, and even to the degree of how doing consults for mothers with breastfeeding concerns, the impact there is quite significant also, right?
Right. I mean, I love my job, and I'm actually really liking doing the video consults because I don't have to wake up and drive and do a home visit at 3 o'clock in the morning. I can just say, give me 5 minutes to wake up and I'll meet you in my computer. Mm-hmm. And generally it's working really well. There are some things, like if a baby needs a tongue tie release, I'm at a loss right now of what to do. There is a local pediatrician I might be able to send them to, but there's a lot of buts.
Yes.
But.
Yeah. And so you're finding that just within our field of birth and lactation, many people are having to use imaginative ways of counseling. I sort of think perhaps we're actually having to use more of our words and having to explain better, and much less hands-on, because we're not doing any hands-on, which might be to some benefit.
Oh, I love that, because according to the RNO best practice guidelines, we're not supposed to do hands-on with moms.
Correct.
We
Yes.
guide, but yes, a lot of people who use that as a backup, because that's what we've always done, they're learning other ways to do it. And I think short-term and long-term, it's going to make us all better breastfeeding helpers.
Yes, yeah. And if you're going to talk to, say, IBCLCs out there that are working and feeling actually quite helpless and hopeless because they've gone, and even teaching prenatal or antenatal, and all services or many services have been cut. How would you share, or what would you share with them about some guidance in their emotions and their feelings?
Acknowledge when you're struggling, because it's so easy to put a smile on and say, oh, everything's okay, I'll get through this. And opposite, sometimes it's really easy just to sit there and cry and say, why me, and all these what ifs. I used to have something called a pity party when I would have a bad day or bad weeks. I would meet my girlfriends at a local place, and we would eat as much chocolate as we possibly could, and we would have one night just to complain about whatever. But when that was done, we had to gather ourselves back up together and get on with the work.
So Stephanie, what I'm hearing is the importance of acknowledgement, and acknowledging those who are out there on the ground doing the work that they're doing, and also an opportunity to vent. Would that make sense? And how would you vent for that?
Yeah, venting in appropriate places would be great, because I'd love to take some of my complaints to Facebook or Twitter, but I have clients there, and that would be inappropriate. And even sometimes, I mean, I have vented in public places before, and it has come back to bite me. So it's knowing where your safe space is as a human being. Mm-hmm. And sometimes it's with people you immediately work with. Sometimes it's somebody not even in your field that doesn't know anybody that you're talking about, so they can't pass on the information. Mm-hmm. But getting it out is really important. Maybe journal. I know one strategy that I've heard is you write it in pencil, like a really scratchy pencil, so you have to push really hard to get your anger out, and then you squish it up, and then you can burn it, and then it's bringing all your complaints and just letting it go into the universe, and that way it's not here anymore.
Okay, I think that's a really, I like that idea of doing that. I've got a lot of burning to get done.
Okay. And I think we have to remember to laugh too. I know when my postpartum depression with that one son, with my third birth, was at its absolute worst, I would watch Whose Line Is It Anyway in 3 different time zones, because that was the only time I could laugh. And I know What About Bob off by heart, because again, sometimes laughing releases just as much as crying.
Yeah, it's a really good oxytocin release.
It is. And I mean, when I need to cry, there's one of 3 movies that I will put in, and it's like, okay, do I want to just cry a little, or do I want to just go gangbusters? So there's levels to crying.
Okay. So if you had one message to share with the lactation community and birthing community for dealing with the grief and trauma related to COVID-19, what would it be?
It's okay to feel bad. That's the most important thing. It's okay. Just don't stay there. Okay. But you have to acknowledge your sad feelings or your anger, and then release it in a healthy way. That's what it comes down to. Releasing can work in different ways and can look different ways. I burn sage at times at home. When I'm really angry, I like noise, so I will put coins in a pop can and then tape it up and then just whoop it against the couch because nobody's getting hurt, and it's this loud, it releases it all for me, and it's quite wonderful actually. It's better than going to punch a tree outside.
That is great. I really appreciate you spending the time with us and sharing your knowledge and your grace. So I thank you so much, and I really appreciate having a talk with you. Thanks again.
Thank you for asking. And anytime I'll come back and I'll try to make you laugh some more.
Sounds great. Okay, thanks again. Bye.
Bye.